I work for Alzheimer's Research UK. So we're based in Cambridge. I had a nice drive through Milton Keynes this morning. The first time I've done that. It's an interesting experience. But I'm very glad to be here today to talk to you about what we do and just to give you a very brief overview of dementia. So Alzheimer's Research UK is Europe's leading biomedical research charity dedicated to finding out more about the causes of dementia and finding new ways to treat, to diagnose, and to prevent the condition. Now, I probably don't need to say too much about the impact of dementia to the people who have come here today. I'm sure many of you will have felt the impact of dementia. We know there are 850,000 people living with dementia in the UK. And of course, it doesn't just affect those individuals, it affects families and whole networks of people. And we estimate that 1 in 3 people have a close friend or family member living with the condition. As well as the personal impact, there's also a financial impact. Dementia costs the economy £26 billion a year, which is an enormous sum of money, more than the cost of cancer and heart disease combined. But despite this, 6 times more money is spent on cancer research than it is on dementia research. Money spent on cancer research is obviously money well spent. But what we think is that dementia is the sort of same scale of issue that cancer is, and research funding should reflect that. So if you look at the global picture, it's even more startling. So dementia care costs would be the 18th largest national economy if you looked at it in those terms. So a huge cost, and it's just getting bigger. Okay, so what is dementia? So when we hear the word dementia, we probably think about memory problems, but actually it's a term we use to describe a collection of symptoms that can include memory problems, but also things like communication problems, personality changes, all kinds of reasoning difficulties. And these symptoms get worse over time, and they affect someone's ability to carry out their daily lives. Now, many people say to me, isn't it just a part of getting older? People might notice that their memory and thinking ability might change a little as they get older. But it's distinct. That kind of normal age-related change is distinct to what we see in dementia. So on that graph there, you can see the solid line is normal aging, maybe some increased change in your cognitive function, your memory and thinking skills as you get older. But in dementia, this is much more severe, and it really does have an effect on the way that people carry out their day-to-day lives. So it's not a normal part of aging, but when we ask people what causes dementia, only 23% were able to said brain diseases or neurodegeneration. The idea that it's a normal part of getting older is quite ingrained in people's minds, and it's one of the attitudes that we're looking to challenge. So what is dementia caused by? It's caused by these diseases, or in most cases are caused by these diseases. So Alzheimer's disease is the most common cause of dementia, responsible for about 2/3 of cases. Then there's vascular dementia, which is to do with problems with the brain's blood supply. Mixed dementia, which is often Alzheimer's disease and vascular dementia occurring at the same time. Dementia with Lewy bodies, a form of dementia that's related to Parkinson's disease. Frontotemporal dementia, where the front of the brain and the temporal lobes on the sides of the brains are affected. You're likely to see symptoms like personality changes and communication problems in frontotemporal dementia, rather than the more memory-led condition that you get with Alzheimer's disease. Parkinson's disease can sometimes lead to dementia, and there are also other rarer forms. So as I alluded to there, what really causes the diverse symptoms, the different and the diverse symptoms, is which area of the brain is affected by a particular disease. So to a large extent, parts of our brains are responsible for different aspects of brain function. So if a disease affects the back of the brain, where we process visual information, you'll get visual symptoms of dementia. So there's a form called posterior cortical atrophy. You might remember the author Terry Pratchett, who had PCA. So he had some visual symptoms before other areas of his brain function were affected. Okay, so all those diseases, they're physical disease processes, as Richard mentioned, and for that reason, we think they will be tractable to medical intervention. And what they all have in common is they cause nerve cells to become damaged and die. So in Alzheimer's disease, this damage to nerve cells is in some way driven by the buildup of these plaques and tangles, proteins that accumulate around nerve cells or inside nerve cells and sort of trigger a cascade that leads to damage to the brain. What you see is that in someone with severe Alzheimer's disease, their brain has physically shrunk. You can see on the right there a healthy brain, and on the left the brain of someone with advanced Alzheimer's disease. And these changes, especially in Alzheimer's disease, this buildup of amyloid plaques, they occur long before people start to develop symptoms, maybe 10 to 15 years before people start to develop symptoms. So part of the work that we do, the research that we fund, is finding out more about these causes. Which really is a vital first step on the road to new ways to help people with dementia, is to understand these diseases better. We're also funding research into better diagnosis of dementia. At the moment, there's no biological test that can tell conclusively whether someone has Alzheimer's disease or one of those other forms of dementia. So misdiagnosis is still, unfortunately, quite common. So we want to find new ways to better diagnose, make diagnosis more timely and more accurate. Now, there are some treatments for Alzheimer's disease specifically, may be given for other forms of dementia as well. So these 4 drugs work by boosting communication between nerve cells in the brain. So you can imagine Alzheimer's disease and other dementias make this communication between nerve cells more difficult, and eventually the nerve cells die. So these drugs will boost the level of these chemical messengers which send signals between nerve cells. And this allows symptoms to stabilize for a year or so maybe. So they don't actually stop the disease process or protect nerve cells from damage, but they can temporarily help with some of the symptoms of Alzheimer's disease. But what we want now is to develop some treatments that can protect the nerve cells from damage. So we haven't seen a new Alzheimer's treatment since 2002. We found out a lot more about these diseases since then. So what we really want to do is translate all this new knowledge that's coming out of universities and research institutes and drive that towards progress that's going to help people affected by dementia. Okay, and to do that, we've launched some initiatives that are specifically focused on this translational research, so taking the academic findings and translating them into new treatments. So we're working with some pharmaceutical companies to pool our resources to take promising new ideas closer to the point where they can be tested in people. And then we also have this Drug Discovery Alliance, so a network of 3 institutes that are embedded in universities. So there's one in Cambridge, one at UCL, and there's one here in Oxford. that are looking to develop these new dementia treatments sooner. Okay, this rather complex diagram is just to show you that I said we haven't had a new treatment since 2002. This is just to show you that there is a lot of work still underway, and it's not that the research has stopped, it's just proving to be a very difficult challenge. So each of those points represents a drug. And as they're closer to the center, they're closer to helping people, being licensed to give to people with dementia. The outer circle is the first phase of clinical trials, and then there's two other phases as you get closer to licensing a treatment. So there's a fair number of trials being investigated, a fair number of drugs being investigated, lots of trials underway, but unfortunately, we haven't yet conclusively shown that there's a drug that can protect nerve cells or that helps people with the symptoms since those four I mentioned earlier. Another thing we're doing is looking for new ways to reduce the risk of dementia. So we know that there are certain aspects of lifestyle that are associated with a lower risk of dementia, and these are things that your doctor might tell you to do to keep your heart healthy. So stay mentally and physically active, control high blood pressure and cholesterol levels, eat a balanced diet, only drink within recommended limits, don't smoke. And those have been shown to be linked to a lower risk of dementia. And what we really want to do is to build on what we know already and find out what people can do so that they don't develop these symptoms in the first place. So we're here in the Oxford Network Centre. We have 15 different network centres around the country that bring researchers in the area together, and as Richard said, supply small amounts of money to kickstart new research. And we brought them all together last week in Aberdeen for our annual conference. So we had nearly 500 dementia researchers travel up to Aberdeen to discuss their ideas and to hopefully forge collaborations in the field. I just thought I'd mention this service to you. It's Join Dementia Research. They've got a stand here today at the front. Now, what this does is it's essentially a research register that you can sign up to take part in dementia research. So none of the research that we fund would be possible without people who take part. So some of this might be clinical trials, giving new drugs to people, drugs that are being tested to people to see how safe and effective they are. But there's all kinds of different studies that are on Join Dementia Research. So you can register by phone or over the internet. So if you come and chat to me or someone at the Join Dementia Research stand later on, we can tell you more about this service if you're interested in getting involved. Another thing we do is provide health information to people. So you'll see we have a table outside with all our leaflets that talk about the different kinds of dementia and some other issues surrounding dementia. We also have an information line that you can call if you have questions about research or you'd like to get involved in research. Another part of what I do is work with the press to try and improve the coverage of dementia. So you see that headline there. It's rather unfortunate and, yeah, unfortunately not accurate. So yeah, when there's a new piece of research, journalists will, and especially the headlines, will sensationalize the findings. So we will provide comments on news stories to try and place the research in context and get across to people what the actual study was showing. So none of the work we do would be possible without our supporters who raise money for us in all sorts of ways. We have someone from our regional fundraising team who's just started to work in the Oxford area, with us today. And I know she's interested in getting a fundraising group together or a supporters group together. So again, if you're interested in doing any of that kind of thing, then please come and see us at the stand during the break. I just thought I'd finish by talking to you about some of our supporters. So these are people who have had experience of dementia in one way or another and then spoken out to try and raise awareness, to dispel myths or just, you know, to tell their story, really. So the gentleman in the top left is called Chris Graham. So Chris has a rare form of Alzheimer's disease that is passed down from parents to children. So it's if you have a parent with this form of Alzheimer's, you've got a 50% chance of inheriting it. It's very, very rare. Only maybe a few hundred families worldwide have familial Alzheimer's disease. But Chris developed Alzheimer's symptoms in his late 30s. And since then, he's talked about it to the media. He's gone on a bike ride all around North America to try and raise funds for us. Ros and Jeremy Underwood in the top center there. Ros has Alzheimer's disease, and she's taken part in research, and she's talked about her experiences taking part in research and tried to encourage others to do so. Top left is Helen Bester. So Helen Bester is actually the head of Human Resources at Alzheimer's Research UK. And like many people working for the charity, she's had personal experience of dementia. Both of her parents have developed dementia, Alzheimer's, and vascular dementia. And she's talked about that in various newsletters and campaigns. The bottom right is Susie Hewer. So Susie's mother died of Alzheimer's disease. And since then, she has run more than 50 marathons for Alzheimer's Research UK. And not content with just running marathons, she also knits as she goes along. So she, at one point, held the world record for the longest piece of knitting while running a marathon, which was pretty impressive. Unfortunately, someone in America, I think, broke her record. Apparently it's quite a hotly contested field. And so she switched to crocheting, which I think she now dominates that area. In the bottom center, that's Helen Griffiths with her father who had dementia. She went on to be a dementia researcher. We now fund her work she does in her lab up in Manchester. In the bottom left is a guy called Paul Bulmer, and he would speak about his experiences for us, and he's there running with a guide because he has that form of Alzheimer's disease that Terry Pratchett had, that visual form. So he needs a guide to go out and run. Okay, so with that, I'll pass you over to Francesca.